Hi, Gabriella. How are you?
Hi, Tando, how you doing?
I'm fine, thank you. Okay, so Gabriella, I've got a few questions for you. As a leader of a humanitarian organization in a developing country like Zimbabwe, what would you say have been the most challenging aspects of running an organization during a COVID-19 pandemic?
COVID-19 has changed the way we work on a day-to-day basis. Something as simple as a needs assessment. A disaster would strike and I would send the team immediately. And now when that happens, you have to pause and you have to think of, do they have enough masks? Do they have enough hand sanitizers? My HR manager calling me now, in the past it would be about salary scales, disciplinary hearings, the staff party. And during the different waves we've had, whenever I'd see that it was him calling, there was almost dread because, I would know that he'd be calling me about a member of staff or more that had tested positive. And with that, there's a whole series of things that we have to do. Do we know if the staff is vaccinated? Do we know if they have comorbidities? We have to contact trace. Where is the nearest hospital? And if there is one nearby, do they have oxygen or do they even have a ventilator? And then obviously there's the whole disinfecting of the offices, informing the donors, informing HQ. If you need to close the office altogether for a week or two, then again, you need to inform them that project activities will be impacted. Our team have been operational for a year and a half, even during lockdown, which means that, again, we are expected to deliver. So it can be quite challenging that way. And certainly nothing would have ever prepared me for that as being a leader of an organization where there is that much anxiety, tension, and pain amongst my staff. But Tando, you've been with me, you've been in the field throughout this time. So what would you say your challenges were?
Well, I think COVID-19 came at a time when we least expected it. And being a programmer in the field, it meant that there were some adjustments that needed to be made. Both at a professional level and at a personal level. I'll just give an example. We're used to having one-on-one meetings, but we had to shift to virtual meetings. And in some of the cases, when you're in the field, internet connectivity was a problem. It was difficult to connect. It was difficult to update the team on what was really happening on the field. And also our work is really, really, really relying on government stakeholders. So we know the state of affairs at the current moment where our stakeholders also have limited access to internet. And also we needed to change strategy because our work as Go Zimbabwe is mostly dependent on community engagement. So there we are, we can't reach the communities, but the work still needs to be done. So that's how then we needed to think outside the box, bring in the mobile awareness, to cater for the informational needs of communities. And also one thing that also came to the fore during this COVID-19 pandemic was the increase in the number of gender-based violence and violence against children. The cases went up tremendously. The coming in of the COVID-19 pandemic made us really think on the need for us to improve our protection services in country, and we hope these efforts that are underway will continue even post-COVID.
Thanks, Tando. Do you think this is just it? This is how we're going to work going forward?
I think this is it for us, Gabi. I foresee us as a country continuing to work like this, continuing to mask up, to wear masks, to social distance, and to prioritize on hand washing and hand sanitizing. And Gabi, in your case, do you think that this is our new normal? Is this how we're going to continue to work?
Yeah, no, I'd have to agree with you, Tando. I mean, Zimbabwe is one of the countries that's, in the forefront of vaccinations in the region. But we're still talking 16% of the population having had 2 doses.
Yeah.
So yeah, I think we will continue to adapt. We'll have to, continue to be flexible, continue to be agile, and hope for the best. But I do think that this way of working is going to be, our way of working for at least a year or two, or until there's going to be a more equitable distribution of vaccines. And this is the new normal. That's the other thing, there's absolutely nothing normal. about this. Thank you, Thando.
Thank you, Gabriella.